Social determinants of health are the conditions in which people are born, grow, work, live, play, age, learn, that affect the health and quality of life, both how long you live and the quality of it. And they're impacted by the distribution of money, power, and resources. And so when we want to address social determinants of health, we have to ask ourselves, where is the power, who has the money, and how are the resources distributed? Right now, we're not living in an environment of health equity. This map may be familiar to some of you. It's funded through the Robert Wood Johnson Foundation, but it shows the life expectancy gaps in different urban areas throughout the U.S. This map shows the zip code of the lowest life expectancy compared to the zip code with the highest life expectancy. And you can see that this is a national problem, that there's no urban area analyzed where there isn't a life expectancy gap, meaning that simply the zip code here is the factor. We're not talking about anything else. It's leading many researchers to start suggesting that perhaps zip code matters more than our genetic code in predicting our health and life expectancies.
So what we're aiming to do with the Roadmap to Health Equity is really focusing on the quality and equity of care, specifically delivered by a very important but often underestimated and sometimes overlooked component of our country's safety net, and that is the free and charitable clinic sector. We know that members of racial and ethnic minorities, people of low income, the uninsured, the medically and socially vulnerable, the very patients that are served by free and charitable clinics are at greater risk for disparities in care.
It means we have to understand that not everybody is starting at the same place, that folks that have experienced racism or grown up in poverty or had adverse childhood experiences or live in neighborhoods with no grocery stores, that this community, this individual needs something different than someone a zip code away to be healthy.